Hello, welcome to your OMT Minute from UPMC Altoona. I want to just give you a little idea of how you might treat a patient that comes in for a headache. We had a patient, a 14-year-old, that was in with our residents for a well check, and we found out that she was having supposed migraines 3 times a week. Well, what I did, and I think Jackie will show you, is I just went over and checked her neck, as Jackie is, and as I felt her neck, I thought, aha, she has some somatic dysfunction in her cervical spine. So I suspected a tension headache because all the high school kids have been virtual schooling, slumped over on phones, and this girl also had a slumped forward posture. And so I said to the residents, let's try to treat her with some OMT. Now we want to show you what we can do kind of quickly because you don't have a lot of time. So after I checked the cervicals, I also checked the thoracics, which Jackie's going to scan really quickly. And then to keep things moving, the first thing I do when I'm trying to treat a patient like this quickly, and I may bring them back for another treatment, is first treat any thoracic dysfunction. So you have 2 approaches, and pick what you like. Dr. Fabina is going to show you a muscle energy approach. And of course this could be done in your office, still seated, without an OMT table. And she's just bringing it into the restriction more as the patient pushes into their ease. Now, Jackie and I favor using HVLA because we think it's a little quicker. She's going to show you that old tried and true cross table lateral technique.
You have them laying down and you're going to do the cross table technique. Basically what you're going to do is whatever side they are rotated posteriorly on, you want that hand to have your thenar and hypothenar eminence right at the bottom of that posterior rotation. Your other hand is going to go onto the other side. You're going to have them take a deep breath in, and as they breathe out, you're going to follow that down, and when you get to the end, you're going to twist. And ultimately then that should correct some of that posterior component and side bending component to give them realignment.
Okay, so now that we've treated the thoracics in whatever way you felt comfortable, whether it was muscle energy or HVLA, we're going to move up to the cervicals. So if my patient could flip on her back. The next thing I always check is the first rib, because so often headaches start with the shoulders being shrugged up in tension. So I check the first rib, and I'm going to show you 2, I think, fairly easy first rib techniques. One, I want you to refer to OMT Total, which is the ACOFP's great OMT product. There is an episode called Upward Cheer. I'm not going to demo it today because we're supposed to be moving quickly, but take a look at Upward Cheer. The technique that I'm going to show you today is a still technique for the first rib. I'm going to take my hand, place it on the area of the first rib, build her. This is my monitoring hand is my left hand. I'm going to hold her elbow. I'm going to put about 3 to 5 pounds of force towards my monitoring hand to feel that my vector of force is from the elbow to there, and then I'm just going to bring her up, arm up, around, and down. So to show that again, my monitoring hand's at the first rib. I'm using the elbow as my force lever, and I'm feeling till I have that localized at the area of the first rib, and then just bringing your arm up, around, and down. And again, take a look at Upward Shear on OMT Total. Next